Hello everyone. Today we're going to be speaking about joint flossing. I'm going to discuss with you what exactly joint flossing entails, some reasons why you should consider including it as a part of your exercise routine, some mechanisms via which joint flossing works, and I'm also going to demonstrate to you how to floss two of your joints, in particular your elbows and your shoulders. And I'm also going to share some joint flossing protocols with you that you can implement. Let us begin. Now, what exactly is joint flossing? Well, it is an exercise, and you can think of it as a joint specific exercise. And the reason why I say joint specific is because the goal of this exercise is not to maximally challenge your muscles, but rather it is to provide your joints and your muscles with a comprehensive stimulus while minimizing the strain that our connective tissue and the other structures that make up our joint experience. And how exactly do we do this? Well, the tool that we use for force application in this exercise is called a voodoo floss band, or simply a floss band, which is very similar to a resistance band. It is a flat resistance band, and the tension from this band is the source of force. So you use this band to wrap your joints, and then you move your joints about in all their different available ranges of motion for a brief period of about 1 to 2 minutes, and then you remove the band, you unwrap it. And that is basically what the process looks like. Now, why do you need to include this as a part of your exercise routine? Well, it not only goes a long way in preserving your joint health over time, but it also makes your joints more resilient and less prone to injury. And some mechanisms via which joint flossing works, well, there are three main mechanisms. It is a combination of force application, and in this case, a very unique way of force application, very close to the joint, which is the axis of rotation, compression, and blood flow restriction or occlusion. So, when we apply force using this band very close to the joint, we are able to stimulate the tissues around that joint while minimizing the reaction forces that the joint needs to produce, thereby placing less strain on the joint. And that, coupled with compression, which provides some external support to the joint and stimulates blood flow, and blood flow restriction, which allows us to stimulate the tissues around the joint using less force and thereby reducing strain on the joint itself, is what makes joint flossing work essentially. Now that you know a little bit about what flossing is exactly, I'm going to demonstrate to you exactly how to floss your elbows and your shoulders. So let's begin with the elbow joint. You want to take this band, and the key is to get this first wrap very secure. Some things to keep in mind. You want to make sure the band makes contact with your skin, and that way it adheres well and doesn't slip off. So here you want to make a loop with the band, wrap it, and as you wrap further up, you want to start from below the elbow, which is distal, and move up towards you, which is proximal. So you want to apply 50% tension in the band, stretch it, and overlap the previous wrap by 50%. So you go 50% tension and 50% overlap, and you continue wrapping up. Make sure you wrap over the joint as well. Ensure that the band does not fold over on itself while you wrap. And as you reach the end, you want to take this end of the band and just tuck it in to that last wrap. like that, and make sure that it's tight. And from now on, you have about a minute to 2 minutes within which you can move about, perform the different motions that your joint is capable of. In this case, with the elbow, it's just flexion and extension. We can also perform some supination and pronation because we also have the radioulnar joint. So keep doing that for about a minute or two until you feel a tingling sensation to move your arm in different planes. Make sure you get a comprehensive stimulus. And once you start feeling a little bit of tingling in your hands, that's when you want to unwrap it. That always feels great. Now, that covers the elbow. Next, I will show you how to wrap the shoulder joint. And the reason why I'm showing you the shoulder in particular is because it's a bit tricky to wrap by yourself. You can use assistance and ask someone for help, but with this technique, you'll be able to wrap it yourself. And for this, I will have to take off my shirt. Okay, I just realized that we still need the mic for you guys to be able to hear me. So here we are with the necklace attachment. That is making me look like a surfing instructor, but let's continue. So for the shoulder, you want to start from proximal and move distally. So you want to start towards you and move away from you. Okay, and you want to start wrapping right over here. There's this little bump that you can feel. We call that the acromioclavicular joint or the AC joint. So if you just feel around here, you're going to find that little bump, and you want to start wrapping right over that. Okay, so this is how you want to start. From behind, use your thumb to pin the end down and just toss the rest of the band over. And for the shoulder, that first wrap, you want to overlap a little more than 50%. You can also do a complete 100% overlap as well. Just make sure that it is secure and the very end of the band doesn't slip out. So that's what our first wrap looks like. Now, you want to take support from a wall, something you can lean against, and pin the band in place. Yep. Now you stretch it, toss it over again. Now you do the 50% overlap and pin it again in place so it doesn't slide off. And then you repeat that entire process of 50% tension, 50% overlap until you reach about this point on your arm where your delts attach into your humerus, the deltoid tuberosity. Basically, where your lateral deltoids end, you want to wrap until there. And just like last time, you want to tuck the end of the band into the last fold, the last wrap, and pull it through so it is secure. If the band has folded over on itself, you can simply roll it back. There. Now you look like Winter Soldier. Anyway, now you have about a minute or two to move your shoulder about in all its different ranges of motion. You want to perform some circumductions in both directions, perform some flexions and extensions. You can also do some adductions and abductions. And over time, you can even add some load to these movements. So you can do like a light overhead press with the dumbbells, the pair of dumbbells, or you can perform some push ups or some wall push ups. It's not absolutely necessary, but it is something you can do. You can do some internal and external rotations in all the different planes. Well, technically, not all the different planes, a bunch of different planes. And once you start feeling that tingling, uncomfortable sensation, that is when you want to take off the band, unwrap it, and immediately you feel that blood flowing back into the joint, and it just feels a lot more mobile. It feels more stable, in fact. And if you've been experiencing any kind of stiffness or a small niggle, again, you're going to feel relief right after your first session. And especially with the shoulder joint, because with the people who hit the gym in particular, our shoulders are so overworked that this is going to feel great. Okay, so that covers the shoulder joint. Now, let me put my shirt back on and we can discuss some protocols for flossing. Whether you're trying to rehabilitate from an injury or you're just trying to strengthen your joints and include joint flossing as a part of your exercise routine. What's the best time to floss? And how often should you do it? We will get to that right after I put my shirt back on. All right, now let's talk about some joint flossing protocols. So, what is the frequency, which is how often should you floss your joints? And what is the ideal time to perform your flossing routine during the day? I would recommend performing at least one full body flossing routine every single day. And by full body flossing routine, I mean all the joints in your body that can safely be wrapped and flossed. These include your shoulders, elbows, wrists, knees, and ankles. So, you want to perform a full body flossing routine at least once every single day. And the ideal time to perform this would be right before your training sessions as a part of your warm up routine. But if for some reason you can't squeeze it in right before your training sessions, you can perform it at a separate time during the day. Just make sure you're getting it done. Now, if you're serious about optimizing your joint health and really making your joints resilient and less prone to injury, then I would highly recommend performing two full body flossing routines every single day. And these guidelines also apply to someone who is rehabilitating from an injury. So, two flossing sessions every single day is the bare minimum. Now, of course, you have to remember to adjust the intensity depending on where you are at in your rehab journey and how much force you can tolerate. You don't always have to obey that 50% tension and 50% overlap rule. You can start with a gentler approach and build up as you become stronger. Now, even for the people who are not rehabilitating from an injury, remember to progressively overload on this exercise because remember, it is an exercise. And the way you can do this is by increasing the tension in each wrap while you apply the floss band. And over time, you can aim to increase the challenge that the floss band provides And you can also increase the duration of time for which you leave the band wrapped. But you have to also be cautious because it is causing some blood flow restriction. So when the feeling becomes too uncomfortable, please make sure to take off the band. Now, that covers pretty much everything that we have to discuss about joint flossing. I hope that was helpful and you learned something, and I will see you in the next one.